Good evening. My name is Pam Kroll. I'm the director for the Sheridan VA Healthcare System, and we cover 3/4 of the state of Wyoming. Thank you for joining us for our virtual Veteran Town Hall with VA leadership this evening. We're very excited for this historic opportunity, as joining us this evening is the Secretary of the VA, the Honorable Dennis McDonough. And he was confirmed on February 8th of 2021 as and was sworn in the following day as the 11th Secretary of Veterans Affairs. So thank you again for joining us, sir, and thank you for joining us this evening for the Town Hall. I also want to let you know that our Chief of Staff, Dr. Eric Crawford, the Associate Director, Scott Morey, and the Associate Director for Patient Care Services, Andrea Henderson, are all on the line this evening as well. Thank you all for joining us. We're gonna have lots of times for questions this evening, and if you have a question for the Secretary, please press the *3 at any time on your telephone to get entered into the call queue. And then some housekeeping for a smooth event, please. Personal medical information and sensitive issues are not appropriate to be shared here, so please limit the information to general questions, as there could be thousands of people on this call. If you do have a question of a sensitive nature, let the screener know that you would like a call back, and we will have someone reach out to you within 24 to 48 hours. We want to take a few minutes at the top of the hour just to give you some updates within the healthcare system across the state of Wyoming. So again, I'm Pam Kroll, the Medical Center Director, and I'm going to turn it over for just a couple minutes to Dr. Crawford and then to Andrea Henderson.
Good evening, everybody. This is Dr. Crawford. I'm so glad to be with you this evening and look forward to the conversation in the town hall. As Pam mentioned, I am the Chief of Staff for the Sheridan VA and have been in that role going on 9 years now. I thought it would be useful at the outset of the conversation tonight to provide an overview of access to different types of care for veterans throughout the state of Wyoming that use our healthcare system, and then also just to briefly touch on efforts that we have made as a system in response to recent and important legislation that pertains to veterans in the form of the PACT and COMPACT Acts. So I wanted to start off by giving you a sense of how long it takes us to get a new veteran seen in foundational services like primary care. So although traditionally we're able to get veterans in to see a primary care provider in about 20 days, we have seen that number increase in the last couple of months due to some provider turnover in some key outlying clinics in our healthcare system. So right now it takes about 26 days to get a new appointment with a primary care provider at the Sheridan VA. And that is right around the national average for wait times for primary care. One thing that I think it's important to note is that 26-day number compares quite favorably to how long it takes to be seen for primary care for veterans in the community. So for a veteran to be seen in the community, in the private sector for primary care, we know that that takes about double the amount of time. It takes about 51 days at present to be seen in primary care in the community. In terms of specialty medical services like physical medicine and rehabilitation, audiology, podiatry, cardiology, most of those ology services that we're able to provide internally, we're doing fantastically in terms of access. So we're able to get veterans in on average in about 19 days to see a specialty medical provider, which is superior to the national average of about 31 days that we see throughout the country. And as you might imagine, in a highly rural healthcare environment like ours, it's also very difficult to get a timely medical specialty appointment in the community. So as of right now, this past month, it took 41 days for a veteran to be scheduled for a specialty medical appointment in the private sector in the state of Wyoming in our catchment. So because mental health is one of the things that we do the very best here in Sheridan, it's a key part of our mission. I did want you to know how those timeframes shake out for veterans that are seeking mental health services as well. I'm happy to say that right now we're able to get veterans in the same week that they are referred for a psychiatry appointment with one of our prescribers. And that's fantastic and far exceeds wait times nationally for the VA. And the area that we're working to improve most within mental health right now is timely access to outpatient mental health counseling. So it takes us about 45 days at present to get a veteran into individual or group psychotherapy for the condition of relevance, and that is a huge target for us to improve on over the course of this fiscal year. I expect with the solidification of our behavioral health implementation teams that we'll be able to cut that number down probably by about a month. And there are right now at present not mental health providers able to be accessed by veterans in the community in every county in the state of Wyoming. But if you are a veteran in a county where you can access private sector mental health providers, it takes about 2 months to get seen. So there's a dearth of mental health resources in the state of Wyoming, and we're doing our best to get people seen timely. So that's kind of a snapshot of our access to care throughout the Sheridan VA healthcare system. And if anybody has questions about that or wants to discuss a particular facet further, I'm happy to do that. I also, as I said, just wanted to touch base on some important legislation that's been passed recently and how we've responded. The first of those acts being the PACT Act, which in a significant way expanded eligibility screening and services for veterans that have been exposed to toxins or environmental hazards during military service. So I'm hoping that most folks that are with us tonight are aware of the PACT Act. This has been an area of strength for us in recent months. We, in response to the PACT Act, developed an environmental health team consisting of a dedicated provider and an administrative coordinator. And because of the efforts of those folks and providers throughout the healthcare system, we have successfully screened over 9,000 veterans for exposure to environmental hazards or toxins. We also have identified about 4,000 veterans that require additional follow-up, connection with appropriate resources and care pertaining to those exposures. And we have done fantastically in facilitating follow-up for those veterans. So as of this month, we have executed follow-up for more than 99% of those veterans that were identified for further needs. Again, I want to get into the conversation as quickly as we can this evening. So I'll just say that as a mental health provider, I'm really excited about the Compact Act. Our number one job, in my opinion, is improving and enriching the lives of veterans and saving lives when indicated. And the Compact Act will provide us unprecedented flexibility in how we can partner with private sector hospitals, emergency departments, and other organizations to ensure that nearly all veterans, regardless of eligibility or enrollment in our healthcare system, have access to timely care and support for crises that involve suicide risk. Just this week, we hired a brand new addition to our suicide prevention team in the form of a Compact Act coordinator who will be our tip of the spear, our first point of contact for those external private sector institutions that are providing services to veterans in the aftermath or in the midst of a mental health crisis. To date, we've had about 86 veterans access emergency resources through the Compact Act. And because of the increased flexibilities that we've been afforded, we've been able to find out about those situations more quickly and deploy wraparound intensive mental health services for those impacted veterans. So that's what I wanted to touch on at the outset of the town hall. I appreciate having the forum to do that. And if anybody has any questions about any of those things or any clinical services throughout our system of care, I'd be happy to address it.
Okay, so this is Andrea Henderson. I'm the Associate Director for Patient Care Services. I'm going to jump off, use Dr. Crawford, some of his points as a jump-off point for how Patient Care Services and how our system, as part of our strategic goal to deliver timely, accessible, high-quality benefits as wraparound services for veterans across our catchment. And I want to highlight, first of all, our Community Living Center. We have 2 neighborhoods. Both neighborhoods are up and running. I'm happy to say that we have bed availability in those units right now to help our veterans who need long-term care, short stay, rehab, hospice, neurocognitive disorders. And those service lines, as our population ages and we're out in those larger communities, that is not just for the Sheridan catchment or the Sheridan area, but throughout the catchment. There is an eligibility requirement. It is a 70%, but we do have the ability to help place veterans if they're not eligible right away, because we also have community contract nursing home availability as well. I will say right now we have 27 patients in our CLC, and we have about 20 patients in our contract community nursing homes. And to keep, but nursing home care isn't always what veterans and their family and their caregivers necessarily want. So we do have other services that help veterans stay in their home. I think the director will talk a little bit about our home-based primary care program, but we have something called Veterans Directed Care. We also have services in caregiver support that support the caregivers who are out there with our veterans, because we want to make sure that veterans have those wraparound services and the care that they need that is integrated, where we can, we know we can do really good care and high quality care. I did want to highlight a couple of our social work programs. We have expanded some of our housing and urban development, our VA housing, we call it lovingly HUD-BASH. And we have expanded that out into some of our tribal areas, notably into the Crow Reservation. And that's, right now we had 15 vouchers, and now we have filled 9 of those. We are working to get access to the other 6, and we're really excited about expanding that particular service line. I would also like to say, in connection with what Dr. Crawford was saying, and that is those primary care throughout the service lines. Patient care services includes dietitians and social work. So we are working very hard to get additional social work help out into the PACS, out into our CBOCs, and to have increased penetration of our dietitians to help veterans live longer and healthier lives. We're really excited about a program that we are working, guns a-blazing, in a Wyoming term, to get our care coordination and integrated case management. We're a phase 3 cohort, and our readiness assessment is completed. And what that means for veterans is when we are up and running on this, many veterans have 2 or 3 or sometimes more than 3 case managers, and that can be confusing and do a lot of telephone tag. So this particular program for those veterans who have lots of services and lots of needs, we try to identify one case manager that will be their point of contact for care coordination. So please expect to hear more about that. Again, we are working really hard to get that up and running for veterans throughout the catchment. And then lastly, I wanted to talk a little bit about high reliability organization. This is to meet our strategic goal of building trust and with our stakeholders, with transparency and accountability. One of the values of high reliability is that it's about the veteran and the duty to speak up. So we have improved across our station our reporting for incidents or near misses or events that may lead to harm to a veteran. And so we are on a mission to get to zero harm. And what we are really trying to do is encourage our staff, encourage our veterans, encourage those caregivers to report incidents so we can work on areas that would improve processes that lead to higher safety. So our journey is never over because we are just continuing to address any concerns. We have a system called JPSR, and that's an internal system. But if you have any concerns out there, reach out to your primary care, your PACT providers, your pharmacists, the RNs, because we want to hear about those concerns, whether it's a missed medication or a medication error or, a missed appointment, because we want to make sure that we get to zero harm. And those are just the highlights from the Associate Director of Patient Care Services today, and I will turn it over.
All right. Hey, my name's Scott Morey. I'm the Associate Director here at the Sheridan VA. And just kind of along the same lines of continuing to provide quality care, we're still hiring providers, nursing staff, and other staff to continue to provide good care to our veterans, and hopefully to keep that care within our system as well. So we are still hiring folks to fill some of those important slots that we need to maintain that access that Dr. Crawford was talking about as well. Another thing I wanted to talk about was we do have some new projects that we have been working on and are going to be moving forward with as well, and one of them is in Sheridan. If you notice, when you come onto the campus, there's a building that's under remodel, and that's to a new area for our mental health providers to start working out of again. But again, just remodeling that, and hopefully that'll be done here this coming fall, and we can open that up to our folks there to come in and receive more mental health. We also have a new project in Rock Springs where we're going to be building a new community clinic there also. And it's pretty close to where the existing clinic is, but that's going to be a ways out. I think they're going to start construction on that here in the next 2 to 3 months. Might see some ground being broke out there. So those are just the few things that I wanted to highlight as the operating officer here. So thank you.
Okay. So that's enough from us. And this is Pam, the director again. And we're going to start taking the live questions. And we're going to start with Nancy. So Nancy, you are live. And please go ahead with your question.
Hi, all that information I'm trying to write as fast as I can, and I'm scared to be the first person. But anyway, most of the ones that I wanted, or I actually had 2 questions, but one was the cutting down on use of meds. It seems like every doctor has to throw his or her specialty's meds at the patient. And I'm on weight. Well, I'm not supposed to do personal stuff anyway, but I'm trying to cut down, and I don't know if that's a way that the VA can help us not have so many, because I don't think they're so necessary as the doctors think. And I'm not a doctor, but And then the other one question I had was if someday are they looking into adding dental to VA benefits? I think
I'll answer the first part for you, Nancy. So
okay.
we're always interested in getting you off as many medications as we can, as much as you are interested in. They all have their purpose, and so we'd want you to get with your provider and talk about what medications could I get off of, which ones maybe can I change, and work with your provider. And there's also pharmacists that your provider works with and that you can work with to get you off some of those medications that maybe aren't 100% necessary, or maybe there's better options out there for you. So we are interested in getting you off medications, especially ones that you don't need. They all fulfill a purpose, and so we'd invite you to get with your provider and or the clinical pharmacist that your provider can connect you with, and we can do that for you.
Hey, Nancy, this is Dennis. I'm Dennis McDonough. So I'm just visiting here in western Wyoming. Thanks so much for getting on the call. And let me just say how proud I am of all the teammates that you've just heard from. Dr. Crawford, I just want to say how proud I am of those access numbers that you briefed. We want to make sure our vets can get in to get care when they need it, as close to them as we can make it. And so I'm proud of our team for doing that. And Nancy, the doctor you just heard from, as you probably know, is Dr. Piper. He came up here to Jackson Hole to meet with us from down in Afton. And it's obvious to me, and everything I've talked to him about, that his number one concern is veterans and what veterans want. And that's what all of those individual briefings were at the start of this call, which is we're trying to structure ourselves to ensure that everything that we want to be responsive to what you need. So on dental, I will say that we are, right now you have to have 100% service connection, and or your service connection has to have a dental impact to get access to dental. We're looking at ways to increase access to dental because of many things, including the new science that tells us that dental health and oral health is connected to your brain health and to your cardiac health. And so we're looking for opportunities to expand access to dental. We're doing that by pilots across the country, so individual trials in different settings. But the main issue for us is going to be funding for that. It's expensive to find the dentists and to get the chairs, but we're looking at doing it. We're talking to Congress about getting additional funding. The last thing, I just want to pile on what Dr. Piper said about you talking to your provider about getting off medicines. One of the things that I'm really proud of VA for doing over the course of the last several years is a focus on what we call whole health. And so through access to things like physical therapy, even access to things like chiropractors, or access to things like battlefield acupuncture. We are trying to make available to you additional support for things like pain management. So as you're talking to your provider, make sure that you're raising your interest in whole health programming as well. But thanks again for the question, and thanks everybody for joining the call today. It's really great to be with you.
Okay, thank you for that. We're going to go to Jerry, and Jerry, you are live.
Yes, I'm a Vietnam veteran, and I'm very satisfied with the services here in Wyoming. I think we're very fortunate to have the services we have here, and also Salt Lake VA. My question is, on a national level, why the hell is the VA providing services for illegal aliens?
Excellent. Thank you so much. And it's Jerry, right?
Yes.
Now, first of all, let me say welcome home. And thank you. On behalf of a grateful nation, I say thank you for your service.
Thank you. I appreciate that.
Yeah, let me reassure you, Jerry, that we do not provide services to undocumented immigrants. And I repeat that one more time. We do not provide services to undocumented immigrants. We provide services to veterans and to veterans' families. I want to say two additional things to that. One thing that we do on the border that I am very proud of, and I was at Yuma, Arizona last year, where we have a lot of Marines in Yuma, at the Marine Air Station there. But we also, in that sector of Border Patrol personnel, we have a lot of veterans. And those veterans have a really hard job working on the border. And they do not have access to care. I was told by some veterans that, they have to sometimes retrieve a body from the river, a dead body. And they're given an hour off their shift to grieve in a break room, and then they're back on the line. So one thing we do on the border is we deploy mobile vet centers and VA counselors to support our Customs and Border Patrol veterans to get them mental health care. And I'm very proud of our providers for doing that. Second, since 2002, VA, through our Financial Service Center in Austin, Texas, pays the contracts for ICE for the care that ICE provides to detainees along the border. So we have less than 10 people in the Financial Service Center who take care of those bills for ICE. No care is diverted from veterans. All we do is, as I said, going back to 2002, all we do is pay those bills to the contractors on behalf of ICE. So that's what we do there, Jerry. I hope that addresses your concern. And if it doesn't, please come back at me on that.
Okay. So next, we have a question from Kyle. Kyle, you are live.
Thank you. So, Dr. Piper, hello again. It's been a while. Anyways, I really enjoyed the care. I've been in the VA services for many years now, and I'm on a different side of the state now. I'm more over on the Sheridan side of the state, and so I've experienced both sides where I was going to the Salt Lake, which was mentioned earlier, and now I'm more primary care through the Cody and Sheridan VA. And I can tell you in the last 2 years, I have seen a significant downturn in quality and time of care. Maybe not the quality itself, but the time it takes to get care is staggering. So Dr. Crawford earlier mentioned a lot of statistics. I don't see those statistics even closely accurate when it comes to me. I don't know, maybe I'm an anomaly, I don't know, but a sleep study, for example, I have been waiting since October to receive. It's now scheduled for May to be seen, finally, in May. So we're talking about over 6 months for community care to get the appointment, and then the appointment's scheduled for months out in advance. I understand I'm being told that the VA is short on this type of care. One of my questions, I guess, is what are we going to do to fix the community care backlog? Because it seems like it's taking a month or 2 months just to make any kind of appointment, whether it's an MRI, CT, or anything of that nature. And then two, if the community care is not available, does Sheridan hold any type of service for sleep studies and stuff of that nature? And I'm seeing this across the board on all specialized dermatology taking 5-6 months. Same thing.
Hey, Kyle. Thanks for calling. This is Scott Morey. I'm the associate director over there. We actually have had some issues with getting folks into community care recently, and we've noted that across the board. We hear about it. So what we did about a month ago was we had a team come in from our regional headquarters and across our area, and they did a project where they were looking at the process of getting veterans into the community care services. And so that we should be seeing a decrease in that. However, on the flip side of that, access into some of the VA services is better than in some of the private sector side. And so some of the problems that we are seeing is not the VA getting you the care in the private sector, but the private sector doesn't have the access either. And so we're trying to work on that as well. So that's part of, that's a kind of a twofold answer to your question, but we are working on it. We have seen that as a problem ourselves, and so we want to make sure that we're addressing that as well. I'm going to let Dr. Piper talk about some of the other services that we have as far as sleep study.
So Kyle, we partnered with the San Francisco VA to try and bring that in-house. And the problem is it was an overwhelming success, and what was a short lead time all of a sudden became a long lead time because everyone really liked the comprehensive service that they were getting. And so the last figure that I heard is that they were 6 months out. So I can definitely understand, and from what I heard with sleep study in the community, it is the wait time is fairly similar depending on where you are at, unfortunately. I can tell you that Dr. Miller, our Associate Chief of Staff, is working very hard to recruit a sleep specialist so that you can get that care done in Sheridan. We're not there yet, but we are working at it, and I'm sure that as soon as we have that available, that you will be able to get in quicker because we won't have as much of that backlog as we currently do from the excitement that was generated by being able to do that through that San Francisco VA consult. When I originally did it, the guy got in all the way through, got his CPAP, and it took about a month from start to finish, and now we're at about 6 months. So you are right on that. Dermatology, it really depends on where you're at, but 4 to 6 weeks is pretty typical, and that matches, and that's mostly because that's what the community allows us to do. We don't have any in-house dermatology currently, and I don't know that we have any plans currently for that, but I will see what I can get, what other information I might be able to get on that in the future, and if you know where I'm at, so you can get a hold of me, and I'll tell you what I learned.
Yeah, hey, this is Dr. Crawford as well. I just want to chime in and say, Dr. Piper, that was a very thoughtful and accurate response, and you took the words right out of my mouth. We are onboarding, or we are working to recruit that sleep-boarded physician that you alluded to with all possible speed, and it is my hope that we will be able to offer much more timely internal services as a result. So thank you for your response, Dr. Piper, and thanks for asking the question, Kyle. I think it's a great question.
Okay, Mark, you are next, and so you are live. Please ask your question.
Can you hear me?
Yes, sir, we can.
Okay, I got notified recently by the VA that they were going to cut my VA benefits because my income went over the level for the plan that I'm on, and the reason for that is that I'm on Social Security, and I've been getting cost of living increases through Social Security, but the income levels that they have for the plans that I was on don't reflect the cost of living, and I'm wondering why.
Hey, Mark, this is Dennis. Can I ask you to do me a favor? Can you email me at Dennis, that's Dennis with one N, so DENIS, .McDonough, that's McDonough, @va.gov. And let me work this issue for you. Let me find out so that you don't have to put it out there on the call here with 2,000 other people, and we'll get to the bottom of it, okay?
Sorry, I didn't get that email address.
Yep. Let me give it to you one more time. It's my first name, Dennis, DENIS, .McDonough, that's McDonough, @va.gov. We'll get right at this, okay?
Yeah, thanks a lot.
You bet, man.
Okay, so now we're going to go to one of the online questions, and Sharon asked, how is the Sheridan VA being affected by the current spending crunch? Some VAs have hiring and spending freezes. So I'm happy to address that. So currently, the Sheridan VA has all the resources it needs to take care of veterans. We did a fantastic job of adding people last year, and so this year, I know you've seen some of the media, and I'll let the VA secretary address kind of the national level. But we have what we need, and so there really isn't a hiring freeze or a spending freeze. We are just looking very carefully at distributing the resources that we do have, and so no worries about that. So I hope I answered your question, and sir.
Yeah, sure, Sharon. Thanks so much for the question, and I've been getting this question lately because I think there is a lot of contingency planning happening across the VA system, knowing that we're coming out of the pandemic and we are entering a new budget period. We had very generous budgets from Congress during the course of the pandemic, going back to 2020, 2021, 2022, 2023. But what we're witnessing now is that those very generous budgets don't necessarily look like they're going to continue. And one only needs to look at the debate that's happening in Washington right now, where we're 5 months into the new fiscal year, and we still don't have a full year's budget for VA outside of the Veterans Health Administration. So I think what you're hearing and what some people in the press are hearing is reactions to that prudent planning that some of our teams are doing. But let me just say that that's planning. That's not reacting to actually what we have right now. And what we have right now is a system wherein we have all the funding we need to care for the vets in the system. In fact, on March 5th, we're opening the doors to potentially the largest expansion of eligibility for veterans in over a generation. We're basically saying if you deployed anywhere after 9/11, you are now eligible for care. And even if you did not deploy overseas, but you were in a billet in the United States where you were exposed to toxins, to nuclear weapons, to chemicals, you are also eligible for care. And we have funding for that increased number of veterans that we anticipate will be coming in. Now, it is true, as Pam said, that we had a very good hiring year last year. And it's also true that what Scott said earlier, which is that we're here in Wyoming continuing to hire especially particular specialties. And across the country where we need specialties, we're hiring them. Among them, first and foremost, mental health professionals, to make sure that we have them. And Kyle, making sure that we have sleep specialists, which is why Dr. Piper and Dr. Crawford are working so hard to recruit that sleep specialist. But it's also true that in some places across the country where we made job offers and we're still too slow to onboard those people we hire, we've realized that we don't need those providers anymore. So where that was the case, some of our leaders have decided to withdraw those job offers. But we are not in a job freeze, and we are not in a spending freeze. but we're going to continue to invest the taxpayers' dollars prudently, as I think they expect us to do.
Thank you. Okay, we have a Facebook comment now or question. This one is denial of community referrals for those living in pain is a real concern. Should we have to fight so hard to get basic care needs met? And that comes from Jeremy.
Yeah, Jeremy, thanks so much. This is Dennis again. Thanks for the question, and I'm really sad to hear that you're fighting in pain. And we really want to work with you to address that. And so I hope that you'll make sure that you're having that conversation with your primary care provider. And if you're not getting access into the community in a timely way, I hope you'll also raise that with the patient advocate at the medical center to make sure that we can make the system work for you. I just want to say two last things. I want to call your attention to, as I said earlier, the whole health programming options that we have for pain management to make sure that we're addressing those concerns. And believe me, I understand that pain is a real thing, and I do not want you to suffer. The second thing I want to say is, in the last fiscal year, 42% of the care that we provided in VA, we provided in the community through referrals to the community. That's a big number. And I am hearing, we just had a great meeting here with the St. John's Hospital team in Jackson Hole about their relationship with us. We heard some frustrations from them here too, but I also hear across the country that we're getting better, that we're more timely on payment, we're better on scheduling. So we're not perfect by any means, but we're getting better. And more of the care we provide is provided through the community. So we want to make sure that you're not feeling like you're being boxed out of those opportunities. So please make sure that you're raising your concerns with your primary care or raise your concerns with the patient advocate, or you also have my email now. Okay? Raise it with me.
And Jeremy, in Sheridan, we actually have an extremely comprehensive pain program that's headed by Dr. McDonald there. And if you talk to your provider, they will get you in. They will take great care of you. And it's like Dennis is talking about with the whole health. They have a physiatrist, so a PM&R doctor, that's their job, is mostly pain medication, injections, things like that. They have physical therapy. They have psychology, dietitian, a complete approach to your pain, not just looking at a back or a neck or an arm. It's looking at all of that and bringing that together. And if you're willing to travel to Sheridan, I've not had a veteran that I've sent there yet that has been disappointed. And if you can't travel, we even have multiple headache clinics, back pain clinics that we can get you into remotely wherever you're at and try and help you. So if you give us a chance and reach out to your doc, we can connect you with some great resources on that.
And a shameless plug, we have one of the few physiatrists in the entire state of Wyoming, and we're very grateful to have Dr. McDonald on our staff. So, yes, please let us assist you with that. So we have a great comment here from James McMillan. Thanks to the folks at the Afton VA for a speedy, no-hassle prescription refill, also for the speedy process getting my knees replaced. So thank you, Dr. Piper. Yes.
Thank you, James.
Yeah. Okay. So we're going to go, this one is from Mary. So Mary, you're going to be live, and you can ask your question.
Oh, hello. Thank you so much for this great conference. It's nice to hear what's going on, especially since we are so widespread in Wyoming. I was just wondering about the possibility of the government shutdown and what VA is doing or what preparations you're making for that.
Yeah, Mary, thanks so much. This is Dennis again. And I have to say, I've never been to your state before, but I've only been here now a couple hours, and I'm thinking of not leaving. It's pretty beautiful. So I'm a Minnesotan, so the snow looks about right, although right now in Minnesota we don't have even a flake of it, to be honest with you. We have funding through Friday. So we need, and we need that for the rest of VA. We need that to be extended. So we're working with Congress and we're working with the White House, and we remain positive, or at least optimistic, that they're going to come up with an agreement to at least extend the funding we have, if not give us a full fiscal year of funding for the rest of this year. That's for everything outside of the Veterans Health Administration. The good news for the Veterans Health Administration is that we have what's called an advance appropriation. So we have all the funding that the Veterans Health Administration needs for this whole year already. So if there is a shutdown, don't worry that anything's going to be impacted for you for your care. You can still get your care. You can still get your pharmacy benefit. You can still get your compensation benefits. And burials at VA national cemeteries would continue if there is a shutdown. Here's what would not happen if there were a shutdown. We could not do outreach. So that plan that I told you about to expand access to care under the PACT Act for all those veterans who deployed somewhere in relation to the global war on terrorism, we couldn't reach out to them. We have another outreach underway right now for veterans who get their education benefit payments at a different account than they get their compensation benefit payments. So we couldn't reach out to them. So we're worried about that. But in terms of your care and your benefits, those will continue even if we don't get even if Congress doesn't come up with an agreement by the end of the day on Friday. I hope that responds to the question, Mary.
Thank you.
Thank you, Mary. Okay, so this is from a veteran employee. What will you do if you find out senior leadership has bullied and mentally harassed disabled veteran employees? What steps will you take?
Yeah, well, we have zero tolerance for disrespectful treatment of any employee, and in particular, veteran employees. And we have zero tolerance for disrespectful treatment of our veteran patients. So what I'd urge you to do as an employee, if you feel that this is happening to you, please be in touch with the Office of Accountability and Whistleblower Protection. You can obviously be in touch with the Inspector General, and those numbers are available to you on all of our, both OAWP and OIG. Those numbers are available to you on all of our internal websites, okay? So if the purpose of your question is to call attention to something that you may be suffering, I want you to not suffer, and I want you to avail yourself of the supports that are available to you.
And then also reach out to the Employee Assistance Program because they can give you some immediate help just for you in addition to that. So that would be also a great thing to do that we have available for all of our employees.
Okay, so we're going to take just a couple more questions. And Robert, I'm gonna, you are live, Robert.
Hello, how are you doing?
Good, Robert. How are you, man?
I'll be honest, I'm a little bit frustrated with physical therapy. I don't feel I'm getting enough, and I've been listening to everything about how quickly everybody's getting their medications. Hey, that's fantastic, okay? In my case, I'm more interested in getting physical therapy than in more meds. I just don't want to feel like I'm drugged up. I'd rather actually be working on improving than just taking meds and, I hate to say it this way, but being worthless.
Yeah. I don't want you to feel that way either. Where are you?
I'm in Casper.
Okay. Let's make sure that we get you connected here so we can work through this. Do you want to say something about this?
So yeah, we actually, it's only been within about a month or two, we actually have a physical therapist at the Casper Clinic. If you show up at the Casper Clinic, we can get you care right there in the Casper Clinic without you having to go see another physical therapist, and you don't have to worry about counting visits or getting anything else done. Just show up at the Casper Clinic and tell them what you need there, and I'm pretty sure your provider will be able to take great care of you, and it's awesome that we now have physical therapy in the Casper Clinic.
Yeah, he is there, but trying to get appointments, he's fighting for me. That's the good news. He's fighting for me. The system is fighting him.
Okay.
Last time I was there, my wife was there with me, and she actually had to stand at the counter for 10 minutes with him, trying to help him get more appointments for me. So he's great. It's the system that's not.
So, Robert, we have your phone number, and we are going to follow up with you because it should be easier than that, for sure.
Yeah, you shouldn't be experiencing what you're experiencing, Robert. So, Pam, the director just said that she'll follow up with you, okay? And if that doesn't happen, drop me a note.
All right, will do. Thank you.
Okay, man. Thank you, Robert, and thanks to your wife. What's your wife's name?
Olivia.
Tell Olivia we thank her for fighting for you too.
Will do.
Okay. And now let's go to Michael. Michael?
If
Go
you
ahead,
guys
sir.
are talking about Mike, that's me. So my question is on plant medicines, and specifically psilocybin, marijuana, and ayahuasca for the treatment of PTSD. There's been a lot of case studies that have really benefited people, and I think this is something that could save lives. Has there been any correspondence between you guys and Congress on helping facilitate these alternatives?
Yes.
Okay, thank you.
Michael, thanks so much for the question. Do you go by Mike or Michael?
Mike, please.
Okay, Mike, thanks for the question. So, in fact, VA has done a series of small trials where we work with private providers, psilocybin for pain management, MDMA for PTS. We've looked at, and by the way, the returns on those studies have been, as you suggest, very positive. I've talked at length with several members of Congress, some of who have had the ayahuasca their ayahuasca treatment protocols themselves, and they swear by them. I promised them, and I promised several veterans that we would take each prudent step we can on this. So about a month ago, we announced that we are going out for requests for research agreements that VA will fund for broader clinical trials than we've done to date on those two psychotherapy assists, that is to say psilocybin for depression and MDMA for PTS. And we think that this is important because FDA, we understand, is relatively close to green lighting those treatments. And so we think it's important that we have more clinical trials specifically for veterans to inform those treatment protocols going forward. I'll just say one last thing, Mike, on this. I'm not a doctor. And I'm also, let me just say, maybe old school. I'm skeptical about marijuana. I'm skeptical about MDMA. I'm skeptical about psilocybin. But I made a commitment to the doctors at VA when I came into this job that when it came to clinical decisions, those are their decisions. They're not mine. So all the evidence has suggested to me that there's positive potential, as you've just said, Mike, for these treatments. And so notwithstanding my own concern about them, we're proceeding on this. But we're going to proceed prudently so that we don't leave our veterans in a bad spot. But thanks very much for raising the question, and thanks for working so hard at yourself, man. I admire that.
I respect and admire that as well. This is Dr. Crawford, and I just wanted to chime in and note that we do have a number of available treatments, both psychotherapies and medicines, that are very effective in the treatment of post-traumatic stress. And I would very much encourage, if you have a mental health provider, to inquire about those options or to connect with your primary care provider about a referral for those evidence-based psychotherapies and medicines.
Thanks, Doc. Good point. Thank you. And thanks, Mike.
All right, so we are almost at the top of the hour. I want to thank you all for joining us. We are at the end of our town hall. It was a great honor to have you with us tonight, sir, and have this opportunity to speak directly with the veterans in our catchment area. Any questions that we didn't get a chance to answer, we will look over those. We actually have your contact info, and we may not have had time for everything, but we will get back to you. So thank you on behalf of the Sheridan leadership team and the Secretary of the VA. I'd like to turn it over to you for just a couple minutes.
Great. Well, thanks so much, Pam. And I want to just say thanks to the whole team in here. It's been a great couple of hours. I've just gotten here, and I'm going to be here until Friday. So I'm thrilled to have the opportunity to be in Wyoming. I'm out here for a very simple reason, which is I work for you, meaning I work for you veterans. I know who nominated me, that's the president. I know who confirmed me, that's the Senate. And I know who I work for, and that's you. It's really important to us that you get the care that you need when you need it. That's why every time you go to a VA appointment, we send a survey to you afterwards. That survey is designed to answer 3 questions. Was it easy to get your appointment? Sounds to me like some of you will answer that question, no, it wasn't. The second thing it's designed to answer is, was the treatment effective? Was the appointment effective? And third, we want to establish, did you feel treated with respect and with dignity when you came to VA? And so I'm really looking forward to the opportunity over the next 3 days to hear directly from Wyoming veterans and to hear from these awesome VA providers, many of them veterans themselves. In fact, many of them still active duty, still reservists, guardsmen and women, to hear from them what we can do at headquarters to be a headquarters element that supports you, that pushes resources and empowerment to the field, doesn't take resources and attention and power from the field. So thanks so much for kicking off this important visit for me to Wyoming with this very important town hall. I thank Mary and Mark and Mike and Kyle and Jerry. I'm sure I didn't get everybody, and Sharon. I don't think I got everybody's name, but thank you so much for joining us. Thank you for choosing VA. And I hope you see in your care at VA that we care deeply about you and we want a relationship with you. And if you have battle buddies who don't have a relationship with us, please urge them to come give VA a try. Thanks so much, Pam. Thank you, team, for the opportunity to be with you.
Yes. Have a great evening, everyone. Thank you.